Welcome. Today we're diving into the fascinating link between caffeine intake and depression severity. Recent research presented at the American Psychiatric Association's 2026 annual meeting reveals that higher caffeine consumption is associated with more severe depressive symptoms. But the story doesn't end there. Caffeine also appears to influence how depression interacts with sleep issues and stress. Let's explore what this means for your daily cup of coffee and overall mental health. Findings come from the SHADES study, which stands for Sleep and Healthy Activity, Diet, Environment, and Socialization. Over 1,000 adults between 22 and 60 years old participated, with an even mix of men and women. Researchers looked at how much caffeine people drank, their sleep quality, stress levels, and depressive symptoms. This comprehensive approach helps us understand the complex ways caffeine, mood, and sleep are connected. To assess depression, the researchers used the Patient Health Questionnaire 9 or PHQ-9. This widely used tool helps measure the severity of depressive symptoms. Alongside, they evaluated fatigue, stress, insomnia, and sleepiness using established scales. By combining these measures, the study paints a detailed picture of each participant's mental health and lifestyle. Caffeine intake was tracked by servings of coffee or energy drinks per day. Interestingly, soda wasn't included in the analysis. Participants reported how many servings they consumed, ranging from none to 7 or more per day. This allowed researchers to see how different levels of caffeine might relate to depression and sleep issues. Results showed a clear trend. Higher caffeine intake was associated with higher depression scores. People drinking 3 to 4, 5 to 6, or even 7 or more servings per day had more severe depressive symptoms. This suggests that while caffeine is often used to boost energy, it may also be linked to greater depression severity. Beyond caffeine, the study found that insomnia, sleepiness, fatigue, and stress were each independently associated with higher depression scores. This highlights how deeply interconnected our sleep, stress levels, and mood really are. If you're struggling with any of these, it's important to consider how they might be influencing each other. Here, where it gets interesting, caffeine appeared to weaken the link between insomnia and depression. Among people with moderate to severe insomnia, those who didn't consume caffeine had the strongest association with higher depression scores. For caffeine consumers, the relationship was still present but less intense. This suggests caffeine might slightly buffer the impact of poor sleep on depression. The same pattern was seen with sleep quality. People who didn't drink caffeine and had poor sleep quality showed the highest depression scores. Those who drank caffeine still had higher scores, but the association was less pronounced. This finding adds another layer to how caffeine interacts with our mental health and sleep. Lead investigator Myra Kaur Marwa was motivated by curiosity about how people use caffeine to cope with low energy and alertness, common in depression. She wanted to understand whether caffeine might mask some symptoms or change how depression, sleep, and stress interact. This biopsychosocial approach helps us see the bigger picture of mental health. Dr. Gregory Scott Brown, who wasn't involved in the research, praised the study but pointed out some limitations. There was no standardized definition for a caffeine serving, and the study didn't distinguish between black coffee and coffee with sugar. Plus, habitual and new caffeine users might react differently. These factors mean we should interpret the results with caution. Caffeine is a psychoactive substance, and its effects can vary widely from person to person. Dr. Brown emphasized that clinicians should routinely ask about caffeine intake, but also cautioned against making broad generalizations from a single study. The relationship between caffeine, depression, and sleep is complex and requires more research. So what does this mean for you? If you're experiencing depression, sleep problems, or high stress, it's worth paying attention to your caffeine habits. While caffeine might help with alertness, it could also be linked to more severe depressive symptoms. And if you have insomnia, caffeine might slightly reduce its impact on your mood, but it's not a cure-all. Experts agree that this is just the beginning. More research is needed to fully understand how caffeine interacts with depression, sleep, and stress. Future studies might look at different types of caffeine, serving sizes, and long-term effects. For now, the best approach is to stay informed and talk with your healthcare provider about your habits. Caffeine intake is often overlooked in clinical settings. Dr. Brown suggests that healthcare providers should routinely ask patients about their caffeine use, especially when discussing mood and sleep issues. This simple step could help uncover important connections and improve patient care. In summary, higher caffeine intake is linked to more severe depression, but it may also slightly weaken the connection between insomnia and depression. The relationship between caffeine, mood, and sleep is complex, and everyone's experience is unique. Stay mindful of your habits and remember that balance is key to both mental and physical health.